we're gonna put the patient in their sideline position. Again, I have already gathered my supplies. I have my table cover here and 3 pillows. That's all we need. So I'm gonna come into the room. Hello, Mr. Jones. How are you this morning? Great. My name is Leslie. I'll be your CNA for today. And I'm gonna be putting you on your side per doctor's orders. Did you wanna face the door or did you wanna face the window? Wanna face the door? That's fine. We can do that. Let me go ahead and set up my table here. Again, I have this away. I'm not hugging this. Open this up. I used to be a server, so I know how to carry stuff, right? And let me set the pillows down here. I will bring this towards where I'm gonna work, so I'm gonna come around this way because they wanna face the door. Bring your supplies near you guys. Don't be walking, running around. So I'm gonna go ahead, before I touch my resident, I wanna go ahead and wash my hands. And I'll also raise this for my back's comfort. Let them know you're raising it. Sometimes they get startled. Okay, maybe this is pretty good for my height. Right, I don't need a privacy blanket. This is enough for a privacy blanket here. Okay, wash my hands. All right, Mr. Jones. And just so you guys could see, I'm gonna just open this up, but I would normally have them covered up. So you see, I'll have them bend this knee, ignore the Foley catheter. This knee, put their arm across them here. This is done with a real human. Bring them towards me or ask them to come a little bit towards you and have them be on their side, okay? This is done with a human. Making sure they are at least 2 inches away from that border, okay? I'm hoping he won't flip over. Feel free to use a side rail for the CNA skill exam. You don't need that side rail up. So I know they are there now. So the first pillow I'm going to put will be the one that goes to their back. Some are flimsy, some are not. I think I might use this one. Okay, and you can come around here so you can see how I'm going to place this. I am still maintaining privacy. Again, the openings go away from the head towards the feet. Let me use this longer. And I want to make sure it's going to go on the heavy area. So right here and here, I, with my body, come down, press down, fold this like a taco, and press down in there. I'll tell them lean back a little bit. Great, so they can hold it. Again, with a human, it's very different. This is not a human, but I need you guys to watch and not be my patient right now. Okay, so there's one. I've got 2 more pillows, right? Why are putting pillows important? One, obviously, so they don't go back. And the other reasons is because we do not want them to be having any of their bony prominences touch either the bed or even their body, because they will get a pressure sore. So again, so you guys can see, I will expose this here. I want to make sure that their knees are not going to hit each other and their ankles are not going to touch each other. So I'm going to get a pillow. I get this one, and it's going to come here. I'm not grabbing. We do not grab. We support. Okay. So do not grab, even the arms, we do not grab, we support. So I'm going to lift, put this underneath them here, making sure that their knees are a little bent. And you can see all that? Yep. And one foot is behind the other. Again, guys, with a human, it's very different. And we have them knee between knee, we have our pillow, between our ankles we have our pillow. Great, we cover them up. And my third pillow, I don't want them on their shoulder like they are over here. They're directly on their shoulder, they're gonna get a stiff shoulder and they're gonna need rotator cuff surgery. So I'm gonna come underneath them, pull a little. And now make sure that this pillow does not, their elbow is not touching their skin here. Supporting, not grabbing, I'm supporting. making sure that their elbows and their wrists are not hitting any body parts. Okay? Always away from the face, because if I have this end open here, they're probably going to be smothered with this plastic, right? And now I'm going to address 4 pillows, not 3. Are you comfortable here, your head? Great, I'm checking you're not on your shoulder, and you are not. Your elbows and your wrists are protected there. Your knees, you move it a little, your knees and your ankles are protected there. I do all around. And you are still on your pillow back here. Great. Now I'm going to do my U. Would you like the privacy curtain open or close? Open. Keep it open. Come around. I'm going to go ahead and lower your bed to its lowest position. Have to make sure your bed is also locked. And the brake is on there. Now I will make sure the call light is within your reach. Are you able to reach that right here? You are. Great. Remember, if they're facing the other way, don't have the call light on this side. Have it so they have it within their reach. It's there. Need to get rid of this, clean my area. That's part of my U. All right, Mr. Jones. Again, my name is Leslie. I'm your CNA for the rest of the day. Feel free to call me if you need anything. Can I get you anything? No, you're good? Awesome. Well, let me wash my hands before I leave. And I have completed my skill.